It's not like this thing is on Google.
Again varies on what location
No.
you're
The
working.
people that are watching want to know. So an hourly rate in Maryland is about $115 per hour. And nationwide is $125 per hour. Hello everyone and welcome back to the channel. Of course, you've already seen from the topic of this video what we are going to talk about today. If you're new, my name is Andy. I am a family nurse practitioner. I had a lot of questions regarding CRNA, what they are, although I do have a video on this channel that was already talked about in detail, so I would recommend you checking that video out. If you haven't seen it, I'm going to link it up here so you can click on the link and watch the video. But today we are focusing on why would you pick one over the other? What are the advantages and disadvantages, the salary, all of that and everything in between. So of course I have a guest because I'm not a nurse anesthetist. So I have a guest today that is going to cover that part, and I'm going to cover my part as a nurse practitioner. I'm going to have my guest introduce himself. I mean, he's been on this channel before, so I don't know if he needs much introduction. But for the people that are new, who are you?
My name is Ntiansu Robin. So basically it's called Doctor of Nurse Anesthesia Practice. Went to school at Georgetown University. At this time I work at a level 1 trauma center across the system, and it's an exciting profession.
Let's throw a little bit of light on CRNA. Like I said, we did a video before, but in the shortest version possible, who is a CRNA? What do they do?
When you want to go into surgery, you need to, let me say, make sure that you don't feel a lot of pain. Make sure you are not aware of what is going on. Make sure you have surgery in the utmost safe possible situation. You need a practitioner, be it a CRNA, be an anesthesiologist, or be an AA, but in this point, a CRNA, to be able to make sure that you're induced and you're asleep for the procedure, your pain is managed, your airway is managed, and your hemodynamics are managed while you're getting that procedure. And sometimes, you know, it could be an awake procedure, but then you still need some sort of sedation to be able to manage pain and also be able to tolerate the procedure that is done. So I would say CRNA is a person that facilitates all this in one while this procedure is ongoing.
So CRNA is someone that gives the pain medication during surgery, make sure that that person is breathing well, and make sure that they are waking up well.
There you go.
Okay. Just for people that don't understand all the medical terms, right? If you're not there yet. So why did you choose nurse anesthesia versus being a nurse practitioner?
I went into the ICU, and it's an interesting and exciting, I would say, environment to work in. And so to be able to continue in that line of work and practice, look like nurse, at this point it's called nurse anesthesiologist, I believe. But it looks like that part, becoming a CRNA, also abbreviated form, CRNA would afford me the ability to practice what I was already doing in the ICU, dealing with complex patients, very sick patients, managing drips, hemodynamic fluctuations, and the ability to at that point take off patients and actually see the effects of the interventions I was doing. So it was something I wanted to do. So I chose to continue in the CRNA route.
I am a nurse practitioner, right? And some people are wondering, why would I pick nurse practitioner over CRNA? And I don't know if I've actually spoken about this on my channel, but I have said this before, that I picked nurse practitioner because I'm not someone that like emergency. I was never someone that likes emergency situation. I like working in a controlled environment. Nurse practitioner, basically you manage chronic illnesses, versus you guys, where most of you that are in CRNA programs or became CRNAs are people that worked in the ICU. I never worked in the ICU, it was never my thing. But most people that work in this ICU are the people that go for CRNA because it's part of your requirement,
Part
right?
of the requirement, yes.
You have to be an ICU nurse before you can become a CRNA.
I mean, as at the time I went, it was about an average of about 2 years. But I'm hearing people doing 1 year, 1.5 year now. But I think it should be at least an average of 2 years. As the time goes by, it changes.
Yeah, so if you're thinking of becoming a CRNA, one of the requirements is that you have to work in an ICU for a certain number of times. So I guess depending on which school you want to go to, you might want to do that research to find out how much time do they require of you to be an ICU nurse before you actually start working, or before you apply into the school, into the program to become a CRNA. So now that we've covered basic point of what a CRNA is, when it comes to the income of our CRNA versus NP, how much do CRNAs make?
I mean, it really varies. I don't think it's a clear-cut number that CRNA makes, because nurse practitioner or advanced practitioners, in general, it depends on the field that you go into. So if you're going into, let's say, behavioral psych NP, they make good income too. Primary care, family practice NP, and acute care NP also, those income varies. So with CRNA, I think they're a little bit in the upper percentile of income, and the number varies depending on the state, depending on the location, depending on the geographical area. Like rural practice make higher income because the access to these people is very limited. So it really depends. At this point, there is no specific number on how much they make.
But they do make more money than nurse practitioners.
Again, it varies so much.
It's not like this thing is on Google.
Again,
why are you trying to be trying
again,
to?
It varies on what location
No.
you
The
work
people
in.
that are watching want to know. Okay, so there's always the average number of how much they make. So in general, what is the average?
I have not looked up what the average is in a long time. And we can look up. Let's look up the average.
Okay, let's look up the average.
I have not looked up what the
people
average
want
is.
to know what this is like. We don't want to know.
Yeah, if I'm giving you that information, it would be a skewed information, because I don't know what the rest of the country makes. I only know what we make or what I make. I don't even sometimes know what any other person makes where I'm working at.
So average salary for CRNA, it says 200K to 270. That's in Washington DC. I guess depending
Washington, DC.
I guess it depending on where you practice again. But it says based on HR reported data, a national average with a geographic differential, it is 219, like 50% median. So it's between 203 to 236, I guess.
Okay.
So an hourly rate in Maryland is about $115 per hour. And nationwide is $125 per hour, I guess. And this is based on, as of December 25th, 2023, on ZipRecruiter. I don't know how reliable this is. So definitely CRNAs make more money than nurse practitioners. So nurse practitioners, let's just clarify that. And you can look this up. You can look this up online. At a 180,000 average annual salary, again, this is in Maryland. CRNAs in Maryland tend to earn more than nurse practitioners. So average of nurse practitioner is 115. Average of CRNA in Maryland is 180. Okay. Nurse midwives is 113. Physical therapy is 90K a year. So definitely CRNAs make more money than nurse practitioners. It depends on who you are as a person, because I always say search yourself, do your research. What do you like? Who are you? Because you don't want to do something based on money. Talk like, say, psych. I'm not a psych person. Even though psych nurse practitioners make more money than family, I'm not going to go into it because of the money, because it's just not something I want to do. So you have to know that and then decide on what you want to do for your, based on yourself. So somebody asked a question. This question is from Methane Business Hub. Dear Andy, with your interview with Nanelle, did you say travel nurses make more earnings than nurse practitioners? How much does travel nurse practitioners to earn? As you made mention of nurse anesthesia, can you throw more light on it for me? Years to study, salary, and do they have travel anesthesia? So I guess we talked about the general idea. We've talked about salary, even though he refused to say what it is. We looked it up. But what about the years to study?
You say I refuse to say.
You
I did not
to
refuse.
say.
No, I did not refuse to
You just
say.
declined.
No, not decline. I'm just saying it's going to be a skewed information, because then if I say, I make $10, and then you find out you go somewhere else and they tell you you're gonna make $8, and you be like, well, he lied to me, right?
It's always an average.
There you go. So I don't know what the average is, because
so
I might not be the average. I might be above the average or below the average. I don't know.
Okay. All right. So what about years to study? How long does it take to become a CRNA?
You're going to go to a 4-year university for your RN, or if you want to start with the 2 years, you will also make sure that you get that 4-year degree, basically. And after that, you want to go into the ICU. You have to go into the ICU, either a surgical ICU or CV ICU. I did a CV ICU. Surgical ICU is basically all surgeries, post anesthesia. If they need patients to go to the ICU, they'll bring the patients there. If it's not ambulatory surgery where they could just leave the OR and go to the PACU and go home, a lot of the most sicker patients will go to an ICU, and they'll go to a surgical ICU. If it has to do with a cardiac surgery, they'll go to a CV ICU, cardiovascular ICU. We have neurosurgery ICU, where patients that have craniotomies and a lot of things that has to do with neuro, they'll go to neurosurgical ICU. I tend to tell people go to a CV ICU or just a standard surgical ICU.
Cardiac, right?
Yeah, the cardiac, or go to maybe a trauma ICU, because the neuro ICU sometimes just tends to focus on what's going on in the brain, and then you're dealing with learning of things that are placed in the brain and all that, and a lot of times it still affects the other part of the body, but centrally with CV and with surgical ICU, you tend to hit every area of the body, and the medications are more centralized that you can manage. A lot of drips are more centralized that you can manage. And so you do that for at least 2 years. And then you go to a CRNA school now with a doctoral program, so you'll do that for 3 years. So 4 years to go to an RN, 2 years to work in the ICU, and then another 3 years to be in the CRNA program. So what is that? That's about 9 years in total. And remember, you are in an RN school. So you go to RN school 4, you get your RN experience in the ICU 2, that's 6, and then 3 years in a CRNA school, that's 9. So total of school and work and becoming a CRNA is 9 years. So
what if you're already an RN? You're already working as a registered nurse, so you just have to go to the ICU for 2 years.
Yep, if you're already working as a registered nurse, you need to go to the ICU. That's what I did. I was already working as a registered nurse, but then I had to transition into the ICU.
So 2 years in ICU, 3 years in the school.
Yep.
Okay. So what would you advise someone that maybe is thinking of going to CRNA school, or trying to decide, should I become a nurse practitioner, should I become a CRNA?
Well, my advice would be, look at your family situation. Look at your family situation. Look at your financial situation, because it's something that your spouse needs to be locked in to do, because you can't work. You can't work for the 3 years. I did not work for the 3 years. So you have to make sure you're financially able to handle not going to work for 3 years, and then you're mentally and physically and situationally able to handle the stress and rigor of anesthesia school. because it's a tough school. There's no way to sugarcoat it. It's a tough school. And handling the didactic and handling the clinicals, it's a tough school. So you have to make sure you're able to mentally, physically, and then financially able to handle all that.
With CRNA, you cannot work. You have to totally be dedicated to school for the entire time. So looking at your family structure is definitely very important compared to a nurse practitioner where you have options of doing it online or doing the traditional going to school every day or how many times a week you want to go to school for, but you're still able to work. So you can do Monday to Friday school, work over the weekends. Nurse practitioner affords you that option of still. I know some people don't work, but if you can work in become a nurse practitioner versus the CRNA where absolutely it's a no. You cannot do that. So what about I forgot to ask this hard question about travel CRNAs. Do they have that?
So travel CRNA, you will, you have locums. It's basically called locums where you go to different areas. So they have travel, they have contract, they have PRNs, they have 1099s, they have all that.
Okay.
So you could travel as a CRNA, but that comes after you've probably done CRNA for like a year or two, and then you feel like, okay, I can handle my own. Some locations are more independent practice than others. So just pick a location that you know fits your personality. If you're a person that is a go-getter and you're very independent and you're like, I'm going to hit the ground running, I could do this and I'm good, then you pick a location that has a little bit more of an independent practice. If you're somebody that you say, well, I want to be able to call somebody to come in the room if I need help, and then you pick a location that has more of a team. It's basically like a medical direction or supervision practice with anesthesiology. So you want to make sure you pick a place that fits your personality and what you want to do.
So in conclusion, these are some key points I just want to put out there. First of all, go watch the video that I have on my channel that talks about CRNA like in detail. Second of all, CRNA versus NP depends on where your family is at, who you are as a person, what kind of personality you have. Are you, like you said, a go-getter, or are you someone that likes a controlled environment? You can still be a CRNA with that, but if you're someone that likes maybe like a outpatient-based clinics and stuff like that, then maybe nurse practitioner is more of what you want to do. Secondly, the money. CRNAs make more money, way more money than nurse practitioners. And I didn't mention travel nurses because travel nurses, you can do overtime, you get more money when you travel. So definitely nurse practitioners are salaried, you cannot make any overtime money. The way that nurses make more money than nurse practitioners is because they can do overtime and pick up more shifts, travel. We have travel nurse practitioners too, but with overtime, you can definitely make more money. Look at your family situation, because with CRNA, you cannot work compared to nurse practitioner where you are still able to go to work and still go to school. So what can your family afford? What can you guys do? Knowing that you are not going to be able to work for three years. Consider also the fact that you have to be an ICU nurse before you can apply to CRNA school, whereas nurse practitioners they don't have that. The only thing is, I always advise to have some experience as a nurse first before you go to school to become a nurse practitioner, because that your knowledge as a nurse will definitely help you. Okay, thank you so much for being here today, even though again he refused to tell us how much nurse CRNAs make. But
hold on, you have to understand it's not about the money. It's about the patient. It's about the profession. So to me, talking about the money is not. It's just one of my principles. I want, when you see a CRNA, you know that it's going to be somebody in there that is going to do their best to get you through surgery. Make sure you have a good experience. And if this is something you want to do, you want to go out there and get it. If I can do it, anybody can do.
Yeah, we understand that, but we still want to know the money.
It's
Because
online.
at the end of the day,
It's on Google.
at the end of the day, you're
It's on
working, you
Google.
love your profession, but you're still getting paid.
It's on Google.
Thank you so much for watching this video. Don't forget to like, share, subscribe, and if you're not subscribed yet, what is wrong with you? Come on. See you on the next video. Love you with the love of God. Bye.
All right, take care.